All right, I want to welcome all of you. My name is Kara Hornbuckle, and I am the Director of Development at Sansum Diabetes Research Institute. And this is our third annual Returning to School with Type 1 Diabetes. And Sansum Diabetes Research Institute is so proud to partner with the JDRF and ADA to make this all possible. I want to let you know that this is being recorded, and we will also be sending out an email to all of our attendees who registered for today. And the ADA and JDRF will be hosting Facebook Live events that will feature today's town hall event. I want to thank all of you so much who registered for today, and we know that many of you have submitted questions. And I want to assure you that we are hopeful to get through as many of those as possible. However, if your question is not answered and we see a theme of a lot of questions that have sort of a similar feeling to them, please go ahead, or just know you can put the question in the chat box, and we will be sure to send that out to all of those attendees who registered for today's event. All right, this is a very, very, very important topic, and this is personal to me. I have two children who live with type 1 diabetes, and it's very important to be an advocate for your child so that they are safe and protected and have access to an inclusive education. And I want to just also share that today, all of the information that all of the information today should really be something that's in guidance with your healthcare provider. And if there's any legal information that's shared today, you can also consult an attorney on that as well. So at this time, without further ado, I want to turn it over to our expert panel, and we'll start with Dr. Frank Hoffman, but I've known Fran for a very long time. So from here on out, it is going to be Fran.
Well, thank you, Kara, and welcome everybody. This is exciting. This is my third year doing this as well. I'm a pediatric endocrinologist at Children's Hospital Los Angeles. I've been doing this for so many years. I barely don't want to tell you. It's in the mid to high 40 range. And lots of change over time, lots of really positive direction, a lot owed to JDRF, ADA, as well as Sansum Diabetes Center. So I'll do my best to answer your questions as the pediatric endocrinologist on the panel.
Thank you, Fran. All right, Crystal.
Hi, everybody. Thanks for joining us. And thanks to Sansum and JDRF for partnering with ADA to put on this third annual Back to School Town Hall. It's very exciting. I'm Crystal Woodward. I'm the National Director of ADA's Safe at School campaign. I've been on staff with ADA for 23 years, but I first began my journey with ADA when my daughter, Devin, was diagnosed with type 1 diabetes in 1991. She's 32 now. Safe at School falls under the ADA's advocacy umbrella, and what we do is we take the protections of federal and state laws in order to keep children with diabetes safe at school and to make sure they're treated fairly. And I look forward to sharing this information with all of you tonight.
Thank you so much, Crystal. Aaron, could you please introduce yourself?
Hi, everyone. My name is Aaron Fischer. I have been a volunteer for the American Diabetes Association for going on 2 decades. I have had diabetes myself since age 19. And I'm currently the chair of the Legal Advocacy Subcommittee at ADA, supporting the work that Crystal and others do there to protect the rights of people with diabetes. And I am in private practice in Northern California as a lawyer, and a very substantial part of my practice is assisting students, workers, and other folks with diabetes who face barriers at school, employment, and in all aspects of life, and trying to make sure that they get whatever they need to succeed in whatever they want to do. So thanks for having me.
Thank you, Aaron. And Beth.
Hi, everyone. I am Beth Braun. I am a health psychologist, and I specialize in type 1 and type 2 with children, as well as other health issues. And I help run a wellness program teaching nutrition and behavioral modification for kids as well. I'm so thrilled you are here. I'm so grateful we are finally talking about being safe at school with diabetes and all the rights and allowances our children have. When I was a kid, this wasn't a topic, and I'm aware because I've had type 1 since 1975, and I'm still here to talk about it, and I work every day and I travel. So the parents that ask, will my child be okay if they're high for 3 hours? Yes, I promise. And I'm just so glad you created time to come join us today.
Wonderful. All right, one last time, I want to thank you all so much for being here, and let's go ahead and get started. Our first question, Fran, is for you. And the question is, what preparations should I make with my endo during the summer leading into the new school year?
Well, hopefully you've already gotten your school orders, or you're in the process of getting your school orders. As you can imagine, a big center like mine with over 1,000 children with diabetes that we follow, we can't do them all in one day. So please be prepared, and then get those school orders, fill out what you need to fill out, and then collaborate with your healthcare provider as to what you want. And the most important thing, I think, is to work with your healthcare provider as to what needs to be supervised, what the child is completely dependent on somebody else doing, such as a school nurse or the health aide, and where they are independent. And get that as a collaborative effort. They need to be revisited throughout the year periodically. If you change therapies or significantly change something about your diabetes management, it's important that you go back and revisit those school orders. And then, of course, go to school, talk to the health aide, the school nurse, the PE teacher, the teachers, and work very collaboratively. I mean, I will tell you that after doing this for over 40 years, there is much more collaboration now between the school, the parent, and the child than I think there ever has been. And part of that is because we've got closed loop systems that make it easier for everybody. We've got parents following the CGM so that they can participate. We've got text messaging going on. But whatever you feel is important for you and your child to be able to do, communicate that in the school orders as well as face-to-face with the school personnel who will be interacting with your child every day. And, be collaborative, work, listen. If something doesn't really sit well with you, work it through. If you need help, go to your healthcare provider. There's always the ADA. Crystal is, I hate to say this, pretty always available with her safe at school information, and it can all be worked out. I've taken care of thousands of children, done thousands and thousands of school orders, and for pretty much, I cannot think of something where we weren't able to work it out. Maybe a little compromise on everybody's side, but it is really doable.
Thank you. That was very well put. All right, Crystal, the next question is for you. My child's school nurse and teachers are wonderful, but does my child still need a 504 plan if everything is going smoothly at school?
Kara, thanks for that question. That's a question I hear all the time. But first, let me just briefly explain a 504 plan. A written 504 plan is developed for students who are eligible for services under Section 504, which is a federal law that prohibits public schools and certain other entities receiving federal funds from discriminating against people with disabilities. And under the Americans with Disabilities Act in Section 504, diabetes is a disability. So what ADA recommends is at the beginning of every school year that families sit down with their school's Section 504 coordinator to develop a 504 plan. Or if your child had a 504 plan the previous year, you'll probably want to update. And many times that happens at the end of the school year. But on to your question, if you have a wonderful school nurse, wonderful administrator, that is fabulous. And, I've been doing this a long time. Fran, I've known you for over 2 decades, and we've done a lot of work together. But we know that most schools do a pretty good job of taking care of students with diabetes. So why a 504 plan? Why go through the what could be a hassle and time and prep and research? Put that 504 plan in place while everything is going well. You don't know if that wonderful school nurse is going to be there tomorrow. You don't know if your child's teacher, who also has a child with type 1 or type 2 diabetes, is going to be there tomorrow. So get that plan. If you haven't started working on it yet, I know that schools vary, their commencement dates vary across the country, but I know schools in Florida, for example, I think they're already back in school. So work hard at the beginning of that school year to get that 504 plan in place. And if you don't have it in place on the first day of school, don't panic. Don't panic. Realize that school nurses, school administrators, teachers, parents, everybody is kind of in this back to school frenzy. So don't panic if you don't have it on the first day of school. But please, please do request of the 504 coordinator in writing the initiation of the 504 process to determine that your child is eligible for 504 accommodations. And then that 504 team can get together and they can get started working on that plan.
That's great. No, that you bring up a good point with our son. We've had 4 school nurses. So you're right, that transition is key. So to have it in writing is very important. Thank you, Crystal. All right. Beth. Oh, go ahead.
Carried forth their 504 so that they could have accommodations for their MCATs, and they're now in medical school. So it is important, not just for what's happening now, but going forward, to be able to get the accommodations you need, particularly for those big exams as they come along.
Yep. And Crystal, a quick follow-up question to that. Once you've submitted in writing to the 504 coordinator, how long do they have to respond? That's a question I get sometimes.
Well, Kara, unfortunately, 504 regulations do not specify a time certain. But what is reasonable? So that's what we need to look at. What is reasonable? In my opinion, once you submit that written request, you should receive a reply from the 504 coordinator, I would say within 5 business days. And one other point I wanted to make was I get questions about who is the 504 coordinator? Well, the 504, your child's school may have a 504 IEP coordinator. Your child's school principal might assume that role. It might be a guidance counselor, it could be a teacher. So one of the first actions you want to take is to find out who that person is in your child's school, and then reach out and put it in writing, because if it wasn't written down, it was never said. And you want to have a written log and written documentation of when you made the request and how the process progresses.
Thank you. I appreciate that. All right, Beth, the next question is for you. It's a very important one. And I want to ask you, what resources for a child who is struggling emotionally at school, both with type 1 and in the classroom, are available?
Okay, so let me start my answer by stating we are in a mental health crisis, children and adults, but especially during this back to school season. There have been studies that have shown anxieties through the roof, diabetes or no diabetes. And so be aware, your kids, no matter what age, they are feeling so uncertain about this school year. Don't downplay it. Hear your children, provide empathy. That's a side note. Now, we were just talking about 504 plans. Well, 504 plans allow a parent to ask for mental health assistance in school. There is something called DIS counseling or district counseling. And does your child need to be assessed while they are in school for anxiety, for depression? And can the school provide the counseling? That being said, If it is an urgent matter, if you have a child, I was just sent a child yesterday who enjoys upsetting his parents by giving overdoses of insulin. So if something urgent like this is going on, you may not have the time to go through the 5-day waiting period, and you have to look around that school and assess for yourself and assess with your child, who can my child lean on for a little emotional support? And as school's starting up this year, encourage your child to really look around and know who is going to be there on the rough days, on the days they don't feel well physically or mentally, on the days that blood sugars are running in the 300s and all they want to do is put their head down. Is there someone on staff that could just be a tiny bit more compassionate? So think outside of the box and think along with your 504 plan. If your child in their 504 plan is being assessed for learning issues, you want to also look under the term ERMHS. Those are emotional assessments. It's either ERMHS or ERICS. And those are two types of assessments that can look at what's going on in the mental health department. Now, why is the 504 plan so important to our child's mental health? I think it's important because it allows the child to really see that there are accommodations, that they're not struggling on their own. And I spoke to 3 different kids this week alone with school starting that had no idea if they had a 504 plan. I found that a little troubling. So parents, communicate with your children what's going on. And students should be aware that they may have more time with assignments. They may have a little more time in the bathroom or be allowed to get water. Small things like that, that means the world to someone with type 1. Now, if you're at a private school, know your options differ, but all the schools should have a list of resources of mental health professionals, of the school counselor themselves, of assistant deans, and be open to listening to your child. When they come home from school, if they don't want to tell you about their day, it's okay, but keep your ears open. Pay attention to how they're acting. Are they completely shut down? Are they socializing? How are they handling the start of the school year? And then talk to them if you are very concerned, to have open, calm, careful conversations. But your schools are there for you, and people at school, the school staff, they want to help. They want the world to be a better place for children. So advocate, advocate, advocate.
Thank you. I think that's very important. All right, Erin, this next question is for you, and it's a long one. So if you need me to repeat it twice, don't be shy. So please describe the federal and state legal rights and protections for students with diabetes and how these laws help keep students medically safe at school and ensure students are treated fairly. And the second part of that is, what steps should parents take to make sure the needs of their child are met in the school setting?
Great, thank you. Well, so the big picture message I think you've already heard, but just to repeat, is you as parents and guardians, your children have rights that protect them and are in place to make sure that every student has the opportunity to have a full enriching experience at school. And so the law is on our side. So what are those laws? So I'm going to focus on federal laws, which apply everywhere in our country. And then there may be some state laws in certain states that provide some additional protections. But even many of those will track much of the federal law that I'll discuss. So the first is, you've heard, Section 504 of the Rehabilitation Act, which requires accommodations to make sure that students have access to the program services and activities at a school. And this is any entity that receives federal funding. Section 504 applies, which is all public schools and some private schools. That sort of plays out through a 504 plan, which you've heard about a bit, and I'll say a little bit more on how to get there in a second. The second law is the Americans with Disabilities Act. And that applies to not only schools, but also camps and daycares and other providers of education, childcare services, et cetera. And has similar protections, making sure that a child with diabetes has the accommodations they need to fully participate. And then the third law that in some cases has some application is the Individuals with Disabilities in Education Act, which is designed to provide services for children with disabilities, for students with disabilities, to ensure that they have access to a free and appropriate education. I have had clients and worked with families where a child might have some other learning disabilities or other school or disabilities that impact their experience at school. And if they also have diabetes, we will sometimes address those diabetes related needs through the IDEA, or an individualized education plan, an IEP. But regardless, under any of those laws, your child has a right to either services or accommodations to get what they need to participate fully. Second part of the question, what steps to take? I'm going to repeat a bit of what Dr. Fran said, because it's right on, and that is work very closely with your diabetes care team. They are going to help you figure out what your child needs. It's all about individual needs. There are great resources that the ADA has with templates and other things to get you started, but you want to work with your child's care team to figure out what your child needs at school. The great thing about working with your child's doctors and nurses and the rest of the team is that they're going to help educate and empower staff at school to help your child. And so what I always say, if I get involved as a lawyer, there's been a problem, what I usually say to teachers, administrators at a school is, well, you have to do these things for this child. And the good news is you absolutely can. And the doctor that you're working with is going to help bridge that very important piece, that this is not something to be daunted by, to be intimidated by. Just like parents and siblings and babysitters and aunts and uncles learn how to assist with the child's diabetes management, teachers and administrators can do the same. So what other steps? Once you have your plan of what accommodations or services your child needs at school, request a meeting and with the school, a 504 team meeting, just like as Crystal was talking about. And at that meeting, be ready with documentation and be ready with your specific requests for what your child needs. And I think we'll talk a little more later in the session about sort of the menu of options or the menu of possible accommodations, though that it really is not limited. It's whatever your child needs to access school.
Thank you. And, one of the things I just want to reiterate, and I'm not sure that this has been said, but I'm sure it will be said, that the ADA is a wealth of knowledge and their website has a lot of great information. So if you're feeling like, oh my gosh, did I get all of this? Just know you can always access their website. And a lot of what Aaron and Crystal have already said, as well as Beth, that information is very easy to find on the website as well. All right, so this next question, I think Crystal, you and I can tackle this one together. This question is, must a school provide a trained school staff member while students participate in field trips and extracurricular activities? And the question to that is absolutely yes. And I want to share that as a mother, I love going on field trips. I love to be present, but the reality is that I'm a full-time, working mom, and I'm not always available. So we do have included in our children's 504 plan that we do need to have somebody trained at all times if one of us should not be available to be able to administer insulin and emergency glucagon and whatnot. But Crystal, is there anything you want to add to that?
Absolutely. Aaron just spoke about federal laws requiring accessibility, and that includes field trips, extracurricular activities, and all school-sponsored events. Even, PTA or chess club or drama club, but certainly field trips. Requiring a parent to accompany a child on a field trip cannot be a requirement for the child's participation in field trip. Okay, so it is the school's legal obligation under those federal laws that Aaron just spoke of to provide a school nurse or another school staff member who has been trained to provide care to your child. And this could be anywhere from actually giving an insulin injection to helping with the bolus, to monitoring CGM, to giving life-saving glucagon. And we know that as our kids get older and achieve more independence and transition to self-management, and they're giving their own insulin and they're counting their carbs and they're monitoring their CGM, everybody with diabetes gets hypoglycemic from time to time. So even the most independent, responsible child will need someone along on that field trip who can recognize and treat a low, including the administration of glucagon. And again, that is the school's legal responsibility under federal law. And also there are many states who have addressed the provision of school personnel at field trips and extracurricular activities through state statute. And to learn more about your state statute, you can go to ADA's website as well at diabetes.org/fedlaws. There's information about the federal laws. There's information about the laws in each state that are relevant to the provision of diabetes care in the school setting.
Fantastic. All right, Fran, I'm sort of laughing at this next question because I was low this week and I was definitely irritable. But the question is, do hyper or hypoglycemia cause irritability? And how can parents educate teachers and other staff, school staff about the impact of blood glucose levels?
Well, hopefully most of the children involved with going to school with type 1 and type 2 diabetes are monitoring, hopefully with a CGM. And if you've not used a CGM, I would advise talking to your healthcare provider about obtaining a CGM, because not only does it give you the number, it gives you the ability for the parent to follow that number, which is changing, about every 5 minutes, remotely. And we found that to be of more and more value than the child can, or the teacher or the nurse or the health aide can also either follow or be informed. And we really want to spend as much time as possible within now what we've defined this target range of 70 to 180. So you can look at the number, you can look at the arrow saying which direction things are going, and really hopefully avert, not all, no way are we ever going to avert all hypo and hyperglycemia, but to certainly see it coming maybe a little bit earlier, be able to intervene a little bit earlier, and then of course use that data retrospectively to change the regimen so there is minimization of glucose values outside this target range. Because why is it so important? We can talk about the long term, but we can talk about the short term. Certainly during hypoglycemia, children do not have complete capability. Their cognitive function is a little bit impaired, and we don't want them to be hypoglycemic. And I think most of the schools and most people who have repeatedly been in front of diabetes know that hypoglycemia can cause some cognitive impairment, but so can hyperglycemia. In the old days when we had poor regulation of glucose and we didn't know because we couldn't monitor it, even with, BGM, toleration of hyperglycemia was better than it is now. Now, when somebody's really spending most of their time in that target range, they don't feel well when they get hyperglycemia. They get headaches, they get thirsty, feel a little irritable, certainly will not perform maximally on any kind of testing as well. So during that encounter, and certainly on the school form itself, you've got your target range for your child. You want to discuss and be sure that when it is outside the target range, assessment is being done, perhaps intervention is being done, and that if the child does not feel well, that could well be the explanation. And particularly during, times of examination, which is why it becomes so important to have that 504 so that you can get the accommodations you need for all tests, but particularly for these important, either standardized tests that your state may be doing. I'm not sure what's going to happen with the SATs going forward or not. But those become very, very important to be sure all that is in the range. And if not, in the middle of a test, somebody ought to be able to raise their hand, stop the clock, fix it, and then come back and be able to make up that time. So what are the steps? You need to define with your healthcare provider your target range, likely 70 to 180. You need to put that on your school forms. You need to inform the school that when it's out of range, either and the child does not feel well, something needs to be done. And then, of course, hopefully you'll have a CGM. So all of that is reevaluated every 5 minutes, and you're following your child as well and can help with some of the intervention.
Fantastic. Beth, is there anything that you want to add to that as a psychologist about just learning and cognition and how diabetes affects that?
Oh, there's so much. I'm glad you asked. So learning and school and diabetes, it's quite a triangle of balance. Diabetes will have a huge impact on learning, and this is the part I'm grateful we're talking about, because otherwise your child could be put in a low IQ group, or they're failing, they're not doing well. But when you have fluctuating and out of range numbers, you have difficulty paying attention, and ADD or ADHD is often very common with type 1. There are problems with memory, math and numbers, visual spatial processing, irritability, as we have said, and I think we'll say a few more times. With the irritability, low frustration tolerance. So if the work is complicated at 120, it's even more frustrating at 220. Trust me, I live it. Low levels of motivation, especially with highs and lows. Schoolwork seems so unimportant when you can't get below 300 all afternoon. And kids also have trouble finding the right words to use in class, or a quick response to an answer, pop quizzes if they're called on. And it can be very challenging to process new information. So with all these factors negatively impacting learning, it's important in the IEP or in the 504 plan to decide, do you need an IEP? Do we need help with learning? The difference, remember, the 504 is just the plan with the diabetes. IEP has to do with the learning. And if you think about the brain function, there is so much of the brain that uses sugar. It is the most energy demanding organ in the body. And so blood sugars being in balance is vital to proper brain function. It is the part of the brain that sends the messaging. Oh, 2 + 2 is 4. That messaging on a more complex problem gets delayed when your blood is thick, when it's high, or not messaging when you're low. When a child has a low blood sugar, anyone, there's no nutrients, there's no processing going on in the brain. And it can lead to confusion, problems with coordination, things to look out for in PE. A child shouldn't be out on the field with a low blood sugar. They can't be handling an exam very well. And there could also be big behavior changes. Also, parents, if you're not aware, when your child's low, your brain and your body are in survival and starvation mode. And you're not listening to what's going on. You're thinking about how many times is my Dexcom going to beep or my pump? Where is the next food coming from? How many kids see that I'm shaking and sweating? And am I going to pass out in front of class? Or does everyone know that I'm sweating through my shirt? And just because the numbers then go back, to 80, 90, 100, doesn't mean that their brain is just automatically fully functioning. I went severely low yesterday and then came back up, and I just saw it took over an hour to be thinking clearly. And we have to allow the kids to express what they need in that moment. If it's to put their head down, if it's to take a break, we need them to be okay and feel safe. They get exhausted. Most of the time I hear from the kids, they get embarrassed when it happens, especially bad lows. Then let's talk about highs for a minute. If you haven't experienced high blood sugar firsthand, it is like walking through fog. It's just total brain fog. You can get a headache, exhausted, so irritable. Some people get stomach pain, nausea, and it's hard to function because you feel like you're going in slow motion. So even if your numbers then come down, your body can have a delayed reaction, and your learning will greatly be impacted from that. Then you add in, does the kid have to leave the class to take care of their diabetes? Are they leaving class to go to doctor's offices or check in with the nurse with problems, or go deal with pump failures, things like that? So parents, make sure there is not just supplies for lows, but also highs, extra water, Gatorade, maybe low carb snacks like string cheese, nuts, beef jerky, things that the kids can eat because they may get hungry when they're high.
Thank you, Beth. Thank you. I appreciate that. All righty. Erin, this next question is for you. What kind of accommodations or modifications are usually provided by the school for the student with diabetes?
Great question. So as I said, there's a very large menu and maybe an endless menu of possibilities. The legal term is very technical. The accommodations must be reasonable. So what does that mean? It's essentially, it should not be something that is so overwhelming to the school that it's changing their program. They're not going to put a doctor in the classroom of a child with diabetes. That is unreasonable. But there are all sorts of things that are reasonable. And I put them roughly into 3 buckets. The first is having staff trained to assist a child with diabetes with daily diabetes management. All the things that you've heard about before, helping with dosing insulin, helping with testing blood sugar, treating a low, glucagon in case of an emergency, and so forth. The second is permitting a child who can manage their own diabetes to do so, and making sure that a child who is able to manage their diabetes either with shots or a pump or anything else, consistent with doctor's orders, are able to take care of their diabetes. So that is not just allowing them to do that rather than dictating care, but also providing some accommodations to do so. Access to water, having food in a classroom, being able to eat in a classroom to treat a low blood sugar or drink some juice. being able to use the restroom if they need to more often than might otherwise be allowed, and those types of things. And the third category, again, sort of roughly, is accommodations to ensure full participation in activities. So that is participation on field trips and sports, in acting and band, extracurriculars, in school recess, allowing kids to participate as fully as possible. That may include things like minimizing the amount of missed class time or missed lunch time to go all the way to a nurse's office and have to sit for 30 minutes to have the nurse help them with a bolus at lunchtime, and trying to minimize missed time as much as possible. And it can also means, like I think someone already mentioned, testing accommodations. If somebody has a lower high blood sugar during the test, that student should be able to get accommodated, take a break, treat the issue, and then come back and complete the test or any other assignment. So those are the types of accommodations. Again, it's really what your child needs, and having the evidence and support from the diabetes care team is what's going to get you across the finish line for that.
Thanks, Aaron. All right, Fran, can you talk about the link between COVID-19 and diabetes? Are you seeing an increase of diagnosis in type 1 diabetes?
So this is the hot topic. There's no doubt. The question is, can COVID, the virus itself, cause diabetes? And then, of course, if you have diabetes, what does COVID infection actually do? So let's take the latter first. It's a little bit easier. So lots of data, lots of studies, lots of reports on the importance of managing glucose all the time, and particularly if one has an intercurrent illness, and in particular if one has COVID. So if glucose is managed well, which usually means you will need more insulin, you might need to come out of closed loop to manage more effectively in manual mode. You need to do that, and you need to really monitor well the glucose, ketones, hydration, everything that's important during sick day management. So no doubt that getting COVID for somebody with diabetes can deteriorate their glucose management, and having poor glucose management can cause extra complications of COVID itself. But the big controversy is, does COVID cause diabetes? So we know in type 1, there's an underlying genetic makeup, and then there's some set of environmental triggers. Most of these environmental triggers are coming quite early in life, and that antibodies develop also quite early in life, and that there is still a slow progression to diabetes. We don't think COVID all of a sudden necessarily causes somebody to go through that long stage to develop type 1 diabetes, in days or weeks. So it may be that what we're seeing is those already on their way, this last virus being the one that kicks them over so that they present maybe a little bit earlier than they would have otherwise. We are also looking at the possibility that we know the COVID virus itself, the receptors for those viruses, this ACE2 receptor is on the beta cell, so that there may be some infiltration of virus into the beta cell itself, and whether that can rapidly lead to type 1, still very, very controversial. So what I will say, and I know this is likely a question later, get your children immunized fully as much as possible. If they're able to get the 2 immunizations plus a booster, go ahead and do that, particularly before school starts. And the best way to minimize the effect of COVID altogether for all of us on the individual health level as well as a population-based level is to be fully immunized.
Excellent. And since we're here, Fran, why don't we go ahead and continue to talk about the vaccine, and let's see, let me make sure I know. So what I just heard you say is that the vaccine is safe for people who have diabetes. Are you also recommending boosters?
Yes, I am recommending what the CDC is recommending. So by age, the 1 booster, soon it will be 2 boosters for the youngest children to get them the 2 shots that they need right now. I know a lot of people say, well, my child just had COVID, I don't need to immunize him. That is not true. You could still vaccinate through a recent COVID infection, and that you should follow the CDC recommendations. I mean, these are the most impressive minds in virology and immunology working on this problem. It's remarkable how fast we got to be able to immunize our population. It is personally upsetting to me that not everybody has availed themselves to be fully immunized. And it is not just going to be this year, it's going to be almost like we do with the flu. And don't forget the flu vaccine this year as well. That will be critically important. And I think what we are seeing is from the pandemic, with the kids being, relatively isolated one from the other, that they haven't had the normal kind of exposure. And so we might be looking at all the other illnesses that one can get. So please be sure your children have had all the other vaccinations that they need as well.
I'm going to ask you a question that's that is a surprise. Now, those children or those that age group that is eligible for Paxlovid, are you recommending that should they get COVID?
So Paxlovid right now is mainly for adults in high-risk groups. So it is definitely somebody over 60 should likely get it. I think the cutoff point for younger age is a chronic illness. So those with type 1 diabetes in adulthood. I had COVID and I took Paxlovid. So it is something that will cut the viral load and the duration of the virus significantly down, and avail yourself of all of the available treatments.
Excellent. All right, switching back over to more about the school setting. Crystal, who's responsible for training the school staff, and what training resources should I provide my student school about type 1?
That's another great question, Kara. The schools have the legal responsibility to train school staff, and their authority to train school staff and what tasks to train on is based in state law. So we know that at least 34 states right now allow schools to train lay school staff in insulin administration, as well as glucagon administration and other aspects of diabetes care. But usually it is the school nurse who will work with the school administrator, the principal, to reach out to try to recruit school staff who are willing to be trained to give insulin, to give glucagon, to learn how to recognize and treat hypoglycemia. So the school nurse many times will reach out to the local diabetes community, will reach out to students' provider to request assistance and resources for training. So it's always a good idea for the parents to be a good resource for their child's school by working with their child's provider to see if they're willing to help with that training. And also, parents, please go to ADA's website at diabetes.org/SAS training. We have a wealth of training resources for the school nurse to use to train school personnel. We have modules, we have videos, we have tips for teachers. There is the ADA School Guide, formerly known as the National Diabetes Education Guide, which incidentally is in the process of being updated, and we hope to have that new school guide very, very soon. But just know it is the school's responsibility to train school personnel. Parents can certainly help. Another way parents can help is we know that every patient or student with diabetes is different. The hypoglycemic symptoms exhibited by my child may be different, Kara, from what your child experiences. So it's very important that the parent be involved with that actual training to make sure it is individualized for that child. So what most school districts will do is they will have a large general training for school staff, and then they will have the parents come in and work with the school nurse to provide that individualized training for each student. And Also training on all the technology. It's so important. And we know it's changing quickly and ever evolving, but it's important for both the school nurse and for trained school personnel to be up to speed on the pumps and on the CGMs. It's just an ever evolving, changing area. So that's very important too. I recommend writing training into that 504 plan. I would write in a provision whereby the school agrees to train a minimum number of school personnel. And then I would work with the school to identify and to list those folks who have been trained right in the 504 plan. And that might change throughout the year because you may have a teacher or a guidance counselor or another trained school staff member leave. But it's very important as well to list that as an accommodation in the 504 plan or IEP or other written accommodations plan.
Thank you. And to touch on two things that you said today, and we've already said this, but there are templates of 504 plans, correct, on the ADA's website. I know I've used them myself as a resource.
Absolutely. And again, that's diabetes.org/504 plan. Couldn't be easier than that. We put it right there in front of you.
Thank you. Thank you for making it easy. And
one thing I want to add is that even with the 504 plans are individualized. So you look at ADA's plan that may be more than your child needs, or it may not be enough. So each and every 504 plan should be individualized for the individual student.
And one other thing I want to clarify one more time, does it have to be a school nurse that's administering insulin, or who can be trained to give insulin?
Kara, that's dependent on state law. Right now we have 34 states where trained school staff who are not licensed healthcare professionals are legally permitted to administer insulin. So it's important to know your state law and what the allowances are and what the prohibitions are. And ADA does have information on all of the state's laws.
Thank you. And Erin, I know you have a hard stop in a couple minutes here, so I want to make sure I get this question answered because I see it's been addressed in the chat. What's the difference between a diabetes medical management plan and the Section 504 plan?
Yeah, it's a great question. So both essential and they work together. A diabetes medical management plan comes from your diabetes healthcare team, the pediatric endocrinologist, or someone from that office, and it describes basically the daily diabetes management needs of the child, of the patient. And it's going to include bolus ratios, it's going to include correction ratios, any reduction in basal rates, all those sorts of things. It'll likely include what the child can manage on their own and what they might need assistance with. The 504 plan is the school document that turns that diabetes medical management plan into a reality. So what does the school need to do to implement all of the child's diabetes management needs? So it can get specific. All the things that Crystal just described, absolutely. Talking about who's going to be trained, how many people will be trained, who's available to assist with diabetes care needs when. And it can identify, it should identify individuals and backup individuals and be very specific to the child and the school setting. But it's essentially the implementation document from that diabetes medical management plan. I saw one question that I just want to comment quickly. Should I share, if I have a plan like that I've worked out, should I send it to the school? Absolutely. I love the idea of being prepared and being very specific in what you hope for your child to receive through a 504 plan, and to set the framework for a discussion rather than relying on the school that may have less expertise, may have a template-y, one-size-fits-all way of doing it. You go, as a parent, I would definitely go in and say, here are the things that my child needs, and start from there.
Thank you, Erin. Now, Beth, this is really important, and I'm going to ask you this question. So I am very public about giving insulin to myself and all do wear any place that I feel comfortable with that. My dog, on the other hand, is a little bit more private. So this is an issue that's very important and it comes up in the school setting a lot. But what can children do so that they don't really feel singled out, or they might be worried that their peers are watching them, administer insulin or deal with their diabetes management?
I love this question. So have a conversation with your child first. How do they want to handle it? They feel so out of control, not asking for diabetes. So do they want to be public? Don't they? And then once they decide, oh, I can have the whole class watch, or I want to do this privately, is there a place in the classroom they can quietly do this? Are they going to the nurse? And if a staff member at schools, such as the teacher, is following their numbers on the Dexcom, how can they quietly nudge them and say, hey, you're 200 or you're going low, so it's not disrupting the class. The other note is teach your child that there's nothing to be embarrassed about. And while it feels like in the beginning of the school year, everyone's looking and staring, they aren't looking and judging, they're curious. The majority of children want to learn about this. And so your child gets a vote in how public or not public they are in this, but do remind them that what they do is not shameful with their diabetes care, and to embrace it and show the kids what warriors they have become since diagnosis.
Thank you. Very well put. Another question for you, Beth, is how do I facilitate a support network for my child to address the emotional side of living with type 1 diabetes and going to school?
Okay, I personally think as a therapist for people with type 1 and as a type 1 person, there is nothing like diabetes. And what is a diabetes? Friend with diabetes. Parents need other friends that are parents of type 1s, and we need it so that people in our lives know what it feels like when you're 50 and you can't stop eating. People need to understand what it's like to have alarms beeping constantly, or to wear a cute dress and your pump is tucked into the sports bra and it slides out. And there's no one on earth that can understand this like other type 1s. So that's the most important. And you can find these people with your local chapters of American Diabetes Association, JDRF. You can look on social media. There's all sorts of groups on Meetup. And then parents, get involved. Volunteer, have your kids come with you to family events, and ask other parents who they use for support. It's also important to know American Diabetes Association has a list of mental health professionals that really have been trained and work in this. And one other tidbit, I think, for especially young kids, but any age, find a role model. Excuse me, find a role model. When I was a kid, I had Mary Tyler Moore and Gary Hall Jr. in the Olympics. Show your kid athletes in the NFL, in hockey, in soccer, because it shows kids they can do anything. And if you really think your child is struggling, talk to them about it, reach out as a parent and ask for help and build your support system, because diabetes is so much easier when you have a village helping you.
Absolutely.
Can I throw in camp in there?
Absolutely. I forgot camp. Camp is vital. And if you can't get your kid to camp, do a day event. ADA has these great day events. I speak at camps all over California. Type 1 Nation with JDRF. They do teen programs, kid programs. It's only a day long. It's not a huge commitment, but I think it's life-changing events.
Thank you, Beth. All right, I'm going to ask one last question to Fran, and this is very selfish because it came up today at middle school orientation. And I think it's a question that a lot of parents can relate to because it was in the chat box. But what advice do you have for parents who are trying to text message and communicate with their children who have type 1 diabetes throughout the school day?
Short of understanding maybe all the legal protection or ramifications, I think it's critical. I mean, if it can be done, and maybe Crystal can add in what the overlay legally is, but I think I have almost all my patients following the CGM, being able to text message at snack, at lunch, either the child themselves if they're old enough to be more independent, or the teacher, or even the school nurse or the health aide, whoever it is. But it's a way to add some insurance. It's a way to you don't know when you're just following CGM, they're a little high. Did they take a correction or not? So text messaging. And I don't think I can at all in any way appreciate that this has interrupted the rest of the class. I see, I have not heard any ramifications. I don't think it interrupts the child's day themselves. And if it can be done, it is something that I think is truly, truly helpful.
Thank you. Is there anything you want to add to that, Crystal?
Yes, I would say that if a parent is going to be texting the child, to certainly establish that understanding up front with the school and write it in the 504 plan. I would also say for students who are dependent on the school nurse or other school staff to provide their care, it may be a different level of texting, because we always want to make sure, at least for those children who are not independent and do not self-manage, it's important to make sure that the school nurse or the designated school personnel who have been trained are always in the loop. So we need to exercise caution there. But otherwise, make sure it's written into that 504 plan.
Excellent. Wow, well, this group has just been a wealth of knowledge, and I want to thank you so much once again for your time today. I know you're all very busy, and we really appreciate your expertise. I want to give a big shout out to the ADA and to JDRF. I want to give a big shout out to Katie Hawk, our Director of Marketing at Sansum Diabetes Research Institute, who was instrumental in making this all possible. And like I said earlier, this will be recorded. We will be sending it out to everybody who is registered. We will also, our ADA and JDRF will also have a Facebook Live event. So you can get more information on an email that will be sent out about that. But I wish every single person watching this today, every caregiver, just a wonderful start of the school year, and just know that there are resources available should you need them. And take good care.